Hello. It is good to see you today, and I am going to give you a lot of information, so I ask you to bear with me as part of this process. First of all, thank you again for your consistent support of Inspira and all the work that we're doing and of our staff. I have been talking to you about the upgrades in our My Inspira app, as well as in our website. And never has it been more important for you to make sure that you're checking those things because there's going to be a lot of changes, a lot of information. COVID has created an opportunity for us to really ensure that we have absolute communication to you on a regular basis because things are going to be changing that quickly. We have seen a tremendous uptick in the number of people that are in need of care, whether it be urgent care or our physician offices or our hospitalization. And unfortunately, there are times when you're going to have to make decisions about how to allocate staff. As I've mentioned to you, our staff are being impacted just like the community is in reference to the spread of COVID, and we are having people out on a regular basis, either being quarantined or with COVID itself. I know that many of you have waited and are in need of care, and that it's tremendously stressful also, in addition to having loved ones there that you cannot be with. We need to make sure that we have staff deployed as they need to be to care for those loved ones, and that means that we will be making some changes. The urgent cares that will close will be Glassboro, Mansue, Woolwich, Somerdale, and Haddon, in order for us to redeploy staff to our hospitals. In addition, our IMG practices, physician practices, will be moving to telemedicine. As much as possible, we're going to try and make sure that you can receive your care that way. That again will allow us to keep you safe and redeploy our most important assets to our hospitals. I know all of this sounds frightening, and believe me, we've been very thoughtful about how we're doing this to make sure that we can still provide access in the community as well as in our hospitals. But right now, given what we're seeing, we must divert our resources to our hospital-based care. So let me just answer a few questions that I've had asked in the community. Different tests, what do they mean? So there is a test called an antigen test. It's a rapid test. That antigen test tells you whether or not there are antibodies that exist within you. It's not as guaranteed, if you will, as the nasopharyngeal test. That's also called the PCR test, but it does tell you whether or not you have COVID. We've tested over 50,000 people since this started. So and most of them have been in the last 3 months of this year. So we know there's going to be a demand for more tests. We're working very collaboratively with our communities to try and set up drive-through tests. And again, I really encourage you to please make sure you go to the website or check your My Inspira app to give up the latest up-to-date information on all of this. We know that these are challenging and difficult times, but there is light on the horizon, and that light is due to start with our healthcare employees, who we are obviously most concerned about being on the front line facing COVID. This COVID vaccine is very complicated. Not only does it have to be stored in a special freezer, one of which we have at Vineland and one of which we have in Mullica Hill. Once they come out, they're not already in vials. They have to each one individually be thawed and have to be distributed, and then we can give the vaccine. It is very important that we have absolutely the perfect of everything to make sure we do this correctly so none of that vaccine gets wasted. We will continue to use this forum as well as our website to really drive all of this information to you, and if this weekly message isn't fast enough, please look at that website. I know all of this is just adding to the stress that we all feel, but there's hope. The hope is this vaccine, and while one of the nurses was telling me yesterday, that's not going to cure everything, it's not. But it's a huge step forward for us. It will give us protection, just like the flu vaccine does, from this virus. And honestly, I'll take that. I'll take that today for our frontline staff that we absolutely need to be healthy and safe, to be able to protect you and care for you. So I end today by saying thank you. Thank you for allowing us to have this kind of relationship, that I can talk with you in this way and share this information. Thank you for continuing to trust Inspira and all of our healthcare providers. I ask for those of you who are celebrating Hanukkah to enjoy your time, to see the light, and until we're together again, be well and stay safe. Thank you.